British drug maker AstraZeneca says its vaccine offers only limited protection against mild disease caused by the South African variant of COVID-19. Now, this follows a test on a group of 2,000 people. The study by South Africa's Wits University and the UK's Oxford University showed the vaccine had significantly reduced efficacy against the South African variant, but it still appears to be fully effective in preventing hospitalization and death caused by other variants of the coronavirus. South Africa received 1 million doses of the AstraZeneca vaccine on Monday, but is yet to begin rolling them out. Well, for more on this, let's now go to Durban in South Africa, where we're joined via Zoom by Professor Willem Hanekom. He is the director of the Africa Health Research Institute and also co-leads a consortium of scientists in South Africa looking into that new COVID-19 variant. Professor, thank you so much for your time. Firstly, what are the implications of this revelation that the Oxford AstraZeneca vaccine is less effective against this new South African variant of the coronavirus?
Hi, Lindy. I think this would be very concerning if this is true. So unfortunately, at the moment, we have not seen the results ourselves. We've only heard the results first through an article that was distributed overnight, and then very limited results released by AstraZeneca. So we need to see the results, because the important part is what you mentioned earlier, is whether this vaccine protects against severe disease. So that's really what we want to prevent. We want to prevent hospitalization and death. And so far, all the vaccine trials that have been out there have been able to do that. So that's really the outcome that I'd like to look at. I'd also like to see from those results how reliable that study would be. How big was the study? Are the results reliable enough for us to reach conclusions at this stage? So, for example, 4 days ago, another study was released from the UK where they looked at whether the same vaccine, the AstraZeneca vaccine, would be effective against the variant that had emerged in the UK, and it was shown to be effective. So, so we need to see the full results.
Of course, as you say, the full results have not been shared with the scientific community in South Africa. But at this point, are you advising that the South African government should continue to import and use this AstraZeneca vaccine?
I cannot give any advice as such. I have no opinion about that without seeing the results. I think it's very, very important for AstraZeneca and the investigators that actually did this vaccine trial to now have urgent discussions with the South African government to see what the implications are of this result. So as I've said, if there is still prevention against severe disease or death, then I think that's more than enough reason to roll out the vaccine. If not, I think we have to seriously think about what we're going to do.
And are there other vaccine options that South Africa is considering at the moment?
Yeah, South Africa has been quite late in getting to the market, in trying to acquire vaccines compared to some other countries of similar wealth. But some other vaccines have already been acquired. For example, some of the Pfizer vaccine has been acquired, but ultimately we have to acquire something like 80 million dosages to vaccinate about 40 million people. And again, we would have to look at whether these vaccines are actually working against the variant of the virus, which is exactly the same virus, it's just changed, but this virus has emerged in South Africa. And we need to see whether those vaccines are working against that variant. And already results from two other vaccines have emerged. And for both of these vaccines, there is protection. There seems to be protection against the variant. It's not as good as it may be against other variants, but there is protection against the variants. And again, to emphasize, there's excellent protection even against this variant in terms of severe disease and death.
Professor Willem Hanekom, thank you so much for your time, joining us there live from Durban in South Africa.